All right. Good afternoon, everybody, or good morning, whatever time it is that you are checking into this recording. And go back one slide. You're in the right place. This is the New Mexico VFC Provider Manual, VFC Provider Participation at a Glance presentation. Today, we're going to be going over the 2025 Vaccines for Children Operations Manual. This manual provides an overview of the VFC program requirements and responsibilities. And this training is based off a companion document that you can find on NEMSIS called the VFC 2025 Program Requirements at a Glance. The New Mexico VFC program appreciates all of our providers who administer vaccines protecting our underserved and at-risk populations. Okay. It is always required to maintain current and complete vaccine management plans, one for emergency and one for routine vaccine management. That includes practice-specific vaccine management guidelines and protocols, names of staff with temperature monitoring responsibilities, and completion dates of required chili and you call the shots trainings for key practice staff. Review and update the vaccine management plans at least annually when VFC program requirements change and when staff with designated vaccine management responsibilities change. Designate a staff member responsible for updating the practice's vaccine management plans. Staff with assigned vaccine management responsibilities must review, sign, and date the vaccine management plans annually, and each time they are updated. Follow emergency guidelines to prepare for, respond to, and recover from any vaccine-related emergencies. Store the vaccine management plans in a location easily accessible by staff, ideally near the vaccine storage units. Designate and maintain key practice staff in the practice's NEMSIS Clinic Tools module. Immediately report to the VFC program changes to your key practice staff. A change in the provider of record or designee requires a assigned key practice staff change request form. There are 4 required VFC roles. First is the provider of record. This is the on-site physician-in-chief, medical director, or equivalent who signs the VFC provider agreement and the New Mexico VFC program provider agreement addendum, and is ultimately accountable for the practice's compliance. This must be a licensed MD, DO, NP, PA, pharmacist, or an advanced practice nurse with prescription writing privileges in New Mexico. Your primary vaccine coordinator must be an on-site employee who is fully trained and responsible for implementing and overseeing the practice's vaccine management plan. Your backup vaccine coordinator must be an on-site employee, also fully trained in the practice's vaccine management activities, and they must be able to seamlessly step in and fulfill the responsibilities of the vaccine coordinator in his or her absence. Immunization, there's also another role that's not listed on this slide, and that is the immunization champion. This is a staff member who goes above and beyond their normal duties to promote immunizations to patients and in the community. Whenever your site has an IQIP visit, an immunization champion should be assigned. Anyone acting in VFC roles, so your provider of record, your primary coordinator, and your backup, must complete the required chili training and you call the shots when hired and annually thereafter. Staff must demonstrate competency in their assigned VFC roles. Any clinician who administers VFC supplied vaccines must be knowledgeable of and familiar with all ACIP recommended immunizations, including schedules, indications, dosages, and new products. All staff who conduct VFC program eligibility screening, documentation, and billing, like the front or back office staff, must be knowledgeable of all VFC eligibility categories, documentation, and billing requirements. All staff and supervisors who only monitor storage unit temperatures or sign off on VFC temperature logs must complete the You Call the Shots vaccine storage and handling module when hired and annually thereafter. They must be fully trained on the use of the practice's data loggers. Trained staff who are authorized to accept packages to immediately notify the vaccine coordinator when VFC supplied vaccines are delivered. Conduct regular vaccine transport drills to maintain competency and readiness for emergencies. This has links to the online training modules. You can also find these in the PowerPoint presentations. Participating provider locations agree to store all VFC supplied vaccines in vaccine refrigerators and freezers that meet New Mexico VFC program requirements. Adherence to storage and handling requirements is certified as part of biannual provider recertification and during both routine and unannounced site visits conducted by VFC field representatives. Use only refrigerators and freezers that comply with VFC vaccine storage unit requirements. Very high volume provider locations must use purpose-built, which are pharmaceutical, biologic, or laboratory grade refrigerators. Other provider locations may use refrigerators and freezers that are purpose-built or commercial grade. Household grade and standalone refrigerators are discouraged. Purpose-built combination units, including auto-dispensing doorless units, are allowed. These purpose-built combination units are like two pharmaceutical units on top of each other. They are not the household combination units. Manual defrost freezers are allowed for the use if the practice has access to an alternate storage unit when defrosting the freezer. You must defrost your manual defrost freezers when your frost exceeds 1 centimeter or the manufacturer's suggested limit. The alternate storage unit must have appropriate freezer temperatures and be monitored using a VFC compliant data logger. Never store VFC supplied vaccines in a soft-sided lunch bag. Never use any of the following for routine vaccine storage: household grade combination refrigerator freezers, dormitory style or bar style combined refrigerator freezers, manual defrost refrigerators, convertible units, or any vaccine transport unit, including coolers and battery operated units. Purchase new refrigerators, purpose-built, or freezers of any grade if your existing storage units malfunction frequently or experience frequent temperature excursions. For your vaccine storage unit configuration, place water bottles in your refrigerators and ice packs in the freezer or frozen water bottles to stabilize temperatures. There is an exception for purpose-built auto-dispensing doorless units or the Pyxis machines, and also pharmaceutical refrigerators and freezers. If the manufacturer does not recommend using water bottles or frozen ice packs, there's no need to use them. Place your data logger buffered probes in the center of refrigerators and freezers near the vaccines. Place your data logger's digital displays outside of the storage units to allow temperature monitoring without opening the vaccine storage unit door. Plug the refrigerator and freezer directly into nearby dedicated wall outlets that don't have built-in GFI circuit switches and are not controlled by light switches. Never plug storage units into extension cords, power strips, or surge protectors with an on-off switch. If your site has access to a generator and has red plugs, please ensure that your vaccine storage units are plugged into these red plugs. Post your do not unplug signs on electrical outlets and circuit breakers to prevent interruption of power. Clearly identify unit space and containers inside of your storage unit that will store your VFC supplied and differentiate from your privately purchased vaccines. Group vaccines by pediatric, adolescent, and adult types. Allocate enough space to position vaccines or baskets 2 to 3 inches away from the walls, floor, and other baskets to allow space for air circulation. Post your temperature log on the vaccine storage unit doors or in another easily accessible location. Equip all refrigerators and freezers, your primary, your backup, any overflow, or any other temporary unit storing VFC supplied vaccines with VFC compliant digital data loggers. For purpose-built auto-dispensing doorless units, built-in internal data loggers must meet VFC program requirements, except for buffered probes, which are not required. The New Mexico VFC program requires the use of the VFC 400 data loggers unless a written request for an exception has been submitted and approved in advance. Use only data loggers that include the following minimum features: a digital display of current, minimum, and maximum temperatures, a minimum accuracy of plus or minus 1 degree Fahrenheit, a buffered temperature probe. Only use the probe that comes with the device. The probe is immersed in a vial that's filled with up to 60 milliliters of liquid. This liquid is usually glycol, ethanol, or glycerin. It can also be a loose media, and this is sand or glass beads. It can also be a solid block of material, which is usually Teflon or aluminum. The digital data logger must have an audible or visual out of range temperature alarm, a logging interval of 30 minutes or less, a low battery indicator, and a memory storage of 4,000 readings or more. A battery source is required for backup devices used during vaccine transport. Data loggers, including backup devices, must be able to generate a summary report of recorded temperature data since the device was last reset. Summary reports must include minimum and maximum temperatures, total time out of range, if any, and alarm settings. Keep on hand at least one backup battery-operated data logger for emergency vaccine transport. Depending on the size of the practice, additional devices might be needed. Digital data loggers must have a current and valid certificate of calibration, including your backup digital data loggers. Configure key settings for your primary and backup digital data loggers, including the device name, low and high temperature alarm limits, immediate notification of out-of-range temperatures, and a maximum logging interval of 30 minutes. Store the backup digital data logger's buffered probe in the vaccine refrigerator and keep its digital display separately. Document the device's location on your emergency vaccine management plan. Calibrate your primary and backup devices every 2 to 3 years or according to the manufacturer's suggested timeline. Always send the device and the probe together unless the manufacturer says otherwise, of course. So if the manufacturer supplies a pre-calibrated replacement probe upon device calibration expiration, the device and probe don't need to be calibrated together. As we said, you're required to keep on hand at least one backup battery-operated digital data logger for use during recalibration. If your primary device breaks, if your primary device doesn't meet calibration requirements, or during emergency vaccine transport. Certificates issued by non-accredited laboratories must meet all VFC program requirements for certificates of calibration. Calibrate your primary and backup devices on different schedules to ensure that all of your refrigerators and freezers storing VFC supplied vaccines are equipped with data loggers at all times. Keep your certificates of calibration on file and make them available to the VFC program upon request. Purchase a new data logger if the existing device or probe malfunctions, is damaged, or if the device provides repeated inaccurate temperature readings. There's an exception for replacement probes recommended and replaced by the device manufacturer. Okay, time to talk about vaccine orders and accountability. Your trained and authorized staff must submit vaccine order requests on NMSIS following the VFC program requirements. Order all ACIP recommended vaccines to meet the needs of the total VFC eligible patient population reported for your PIN. Best practice is to order only one brand and formulation for each vaccine to avoid administration errors and waste. Order all vaccine doses in sufficient quantities to last until the next order period. Order quantities must factor in the doses you administered since your previous order and the doses you have on hand at the time of the order. Order your vaccines according to your location's assigned order frequency or as guided by the VFC program. Provider locations that have not ordered and administered all ACIP recommended vaccines for their patient population in the past 12 months will be terminated from the VFC program. Vaccines ordered solely to prevent account termination that are then lost due to expiration will be considered a negligent loss. Newly enrolled providers must order within 3 months to maintain their active enrollment in the VFC program. Order vaccines using the approved practice PIN address for that VFC provider. Account for every dose of VFC supplied vaccine ordered and received by that provider location. Report all vaccine doses administered since the previous order and all the doses you have on hand on each monthly recon. Doses administered must be based on either NMSIS or your electronic health records administration summary reports. Maintain accurate and separate stock reports for your privately purchased vaccines and make them available to the VFC program upon request. If your VFC PIN number is 1 through 399, your ordering window is the 1st through the 15th. If your VFC PIN is 400 and above, it is the 16th through the end of the month. Vaccine ordering and inventory management is on NMSIS, which I'm sure you guys are very aware of by now. So please follow all VFC program requirements and never reject a vaccine shipment. So if you get an unexpected delivery, please receive, inspect, and store those vaccines and diluents within manufacturer recommended ranges immediately upon delivery. Immediately receive all shipments into inventory in NMSIS, either using a hyperlink or by manual entry. Keep all the packing slips for all vaccine shipments received, including publicly funded and private vaccine shipments. The reason for that is often vaccines that are shipped have the same lot numbers, so it's difficult to differentiate what shipment was private and which one was through the VFC program. So if we have those packing slips, it's easier for us to tell where they came from. The practice must be open with staff available to receive vaccines at least 1 day a week, other than a Monday, and for at least 4 consecutive hours to receive shipments. If there are any discrepancies between your packing slip and your order, a late or incorrect delivery, or any other problem, complete the shipment order incident report that can be found in NMSIS reports and send it to vaccine.orders@doh.nm.gov. All right, vaccine storage. Make sure that you dedicate vaccine refrigerators and freezers to the storage of vaccines only. If you need to store other medications or biologics in the same storage unit, please store below vaccines on a different shelf. Store all frozen vaccines, your Merck, MMR, MMRV, varicella, and Moderna COVID-19 between 58 and 5 degrees Fahrenheit, according to manufacturer recommendations. I'm sorry, that's -58 Fahrenheit and 5 degrees Fahrenheit, according to manufacturer recommendations. Store all other refrigerated vaccines between 36 and 46 degrees Fahrenheit, according to manufacturer recommendations. Store vaccines in their original packaging and allow space for air to circulate. Store VFC and privately purchased vaccines separately and grouped by vaccine type. Do not store vaccines in storage unit doors, drawers, or bins. Place your vaccines with the earliest expiration dates towards the front of the storage unit and use them first. Always store VFC supplied vaccines at the approved location for the VFC PIN. For practices conducting outreach clinics, please obtain VFC approval at least 4 weeks prior to the scheduled outreach clinic. Monitor and record storage unit temperatures on the correct regional temperature log. Record your current min-max at least twice a day. at the beginning and end of each business day. For immunization program approved outreach clinics, special event clinics, health fairs, special school clinics, and mass vaccination clinics, you must monitor and record your min-max temperatures on the outreach temperature log every hour. Attach the data log or download or summary report if available to the VFC refrigerated vaccine transport log. Temperature logs must be legible and completed accurately in ink. Neatly cross out correct initial and date any advertent documentation error immediately. Download temperature data files and review for any unreported out-of-range temperatures at the end of every month. The date to upload your temperature logs is on the VFC calendar in purple. Replace doses on a dose-for-dose basis as instructed by the VFC program if your storage unit temperatures are not monitored and documented, if temperature logs or data temperature files are falsified, or if temperature logs or temperature data files are missing during a site visit. Always retain your temperature logs and temperature data files for 3 years, even after your provider location is no longer participating in the VFC program. All right, if you have ever experienced a temperature excursion, you must take action. So take immediate action to prevent vaccine spoilage and to correct any improper storage condition for all out-of-range storage unit temperatures. You must respond to all data logger alarms. So the first thing you want to do is quarantine and do not administer any vaccines when there's an alarm going off until you can determine the viability. And you'd want to do that with the help of the vaccine manufacturers. So you report every temperature excursion every time to your regional immunization coordinator and comply with any instructions provided. Report any data logger that is recording temperatures for a storage unit that's storing VFC vaccines. You'll contact the vaccine manufacturers as indicated, and they will help us to determine if your vaccines are okay to use. Just always, always, always err on the side of caution and call us if you have a question. All right, vaccine inventory management. Conduct a physical vaccine inventory monthly and before ordering vaccines. Use the vaccine physical inventory form or an equivalent electronic or paper form. Always rotate your stock and move your short-dated vaccines to the front of the storage unit. Never borrow VFC supplied vaccines to supplement your private stock or vice versa. For vaccines that will expire within 6 months and cannot be used, notify your regional immunization coordinator to obtain approval prior to transferring short-dated doses to another active VFC provider location to prevent negligent vaccine loss. If you don't have another provider that you know will be able to use those doses, complete the VFC attempt to transfer form. The VFC attempt to transfer form must be submitted with an expiration date on those vaccines at least 3 months. If the attempt to transfer form is received and the vaccine's expiration date is less than 3 months, that form is not valid and will not be accepted. Make sure that you remove spoiled, expired, and wasted vaccines from storage units after identification to prevent inadvertent use. Report all spoiled, expired, or wasted vaccines of VFC supplied vaccines into NMSIS prior to submitting your new vaccine order. Do not report any VFC supplied vaccines as spoiled without first submitting your troubleshooting record. And the number of doses that you are returning must match exactly what is on your troubleshooting record. Monitor vaccine storage units regularly and purchase additional storage units if capacity cannot accommodate the inventory in a manner consistent with VFC program requirements. All right, vaccine transfers and transport. If your transfers are approved, only transfer VFC supplied vaccines to other VFC provider locations. Report all vaccine transfers to your regional immunization coordinator. Never routinely transfer VFC supplied vaccines to or from other VFC provider locations. Transport vaccines only when necessary and follow the guidelines for proper refrigerated vaccine transport. Complete the vaccine transport log each time vaccines are transported. In case of emergency, only transport VFC supplied vaccines to their alternate storage locations equipped with vaccine storage units and temperature monitoring devices that meet VFC program requirements. If you're unable to transfer without risk to yourself or your staff, leave the vaccines in the storage units and work the troubleshooting record in the recovery period. Never transport VFC supplied vaccines to personal residences. Use backup battery-operated digital data loggers to monitor temperatures during vaccine transport and at VFC-approved off-site clinics, ideally using a portable vaccine refrigerator. If one is not available, use qualified containers and packouts. Replace any vaccines that were transported without proper documentation of temperature monitoring on a dose-for-dose basis as instructed by the VFC program. All right, screening and eligibility and documentation. Screen all children from birth through 18 years of age for VFC eligibility. So all children who are Medicaid eligible, uninsured, American Indian or Alaska Native, and underinsured children seen at an FQHC or an RHC prior to vaccine administration at every immunization visit. The state of New Mexico also purchases vaccines for privately insured children, so all children ages 0 through 18 years of age may receive VFC vaccines at no cost. Document all elements of VFC's patient eligibility screening record form, including the screening date, VFC eligibility, and any other eligibility criterion if met. Keep all VFC eligibility records on file for 3 years, even after your provider location is no longer participating in the VFC program. The VFC program entitles eligible children to all vaccines recommended by the Advisory Committee on Immunization Practices, or ACIP. As a VFC program participant, your practice is also required to ensure that VFC eligible children have access to ACIP recommended vaccines not routinely administered, like the meningococcal B and PPSV 23 vaccines, and make them available when indicated or requested. So in practice, what this means, if you have just 1 or 2 patients that need these vaccines, you can call your regional coordinator, or you can call the help desk, and we can help locate just 1 or 2 doses of these so that you don't have to order an entire box and end up wasting doses. ACIP recommendations and standards. Follow the program requirements. Always distribute the most current VIS or immunization information statement for nirsevimab or Beyfortus before vaccine administration. Maintain records in accordance with the National Childhood Vaccine Injury Act, which includes reporting clinically significant adverse events to the Vaccine Adverse Event Reporting System. For nirsevimab, when not co-administered with other vaccines, report all suspected adverse reactions to MedWatch. Report suspected adverse reactions following co-administration of nirsevimab with any vaccine to VAERS. Acknowledge that revaccination is recommended if non-viable vaccines have been administered to patients. Here are the federally required documentation elements. For every vaccine given, every time they're given, this is required. We must have the name of the vaccine, the date it was given, the route and site, lot number and manufacturer, the name and title of the person who administered it, the practice's name and address, and the VIS publication date and the date it was provided. Vaccine administration and reporting to NMSIS. Katie's presentation goes over this as well. Report all doses administered to NMSIS, and data must include all required administration elements from the previous slide. Report doses administered under your corresponding VFC PIN number that received the vaccines. This is the actual wording of the law. Per Senate Bill 58, physicians, nurses, pharmacists, and other healthcare providers shall report all immunizations administered to NMSIS unless the patient or the patient's parent or guardian, if the patient is a minor, refuses to allow reporting of this information. All administered immunizations must be reported to NMSIS, including but not limited to adult, pediatric, and employee vaccinations. Administered vaccines must be reported to NMSIS per the time reporting guidelines. Smaller practices with no EHR can use daily usage logs to record doses administered throughout the day and then report those doses to NMSIS. I do have daily usage logs that I have created in NMSIS in the reports tab, and there is one for adults, there's one for adolescents, and there's one for pediatric. Always administer all VFC supplied vaccines at the approved practice address for the provider PIN. Do not refer patients to other facilities where they might be charged for vaccine administration. For VFC approved outreach clinics, special event clinics, health fairs, special school clinics, and mass vaccination clinics, please get approval from the VFC program at least 4 weeks before the scheduled event. Frozen vaccines may not be administered off-site. The practice must submit a summary report that includes doses administered within 15 days after the end of the clinic. Recommend non-routine ACIP recommended vaccines when indicated or when requested. Acknowledge and follow VFC program and manufacturer guidance, including revaccination, if non-viable vaccines have been administered to patients. Okay, this slide needs a bit of an update because the charge has been increased for the first dose. Immunize all VFC eligible children with VFC supplied vaccines at no charge to the patient for vaccines. Do not deny vaccine administration because the parent or guardian is unable to pay the administration fee. Provider locations may charge VFC eligible children, i.e. insured, uninsured, American Indian, Alaska Native, and underinsured children seen at FQHC or RHC, up to the current federal maximum regional administration charge of $25.75 per dose, which is not per antigen of vaccine. For VFC eligible children, you must waive the administration fee if the parent or guardian is unable to pay. Never bill parents who are unable to pay the waived administration fee. Specialty providers such as pharmacies, urgent care, school-located vaccine clinics, or birthing hospitals must agree to vaccinate all walk-in VFC eligible children and not refuse to vaccinate these children based on a parent's inability to pay the administration fee. Walk-in refers to any VFC eligible child who presents requesting a vaccine, not just established patients. Walk-in does not mean that a provider must serve VFC patients without an appointment. If your office policy is for all patients to make an appointment, then the policy does apply to your VFC patients as well. Walk-in may also include VFC eligible newborn infants at a birthing facility. For the most up-to-date billing guidance, always refer to NMSIS. Program enrollment, recertification, withdrawal, and termination. So if you have a prospective provider, they must specify key practice staff, complete their necessary training requirements, download and review job aids, comply with storage unit requirements, and complete and submit the VFC provider application for review. The application can be accessed via the link here. Upon approval, an enrollment packet will be sent to your clinic for completion. All documents that need a signature now use digital signatures. Any digital signature software is acceptable if it has a timestamp. These include Adobe Acrobat Sign, Sign Now, Small PDF, and others. And now biannually, each VFC site must recertify their participation in the VFC program by updating their information, providing required annual training certificates, and signing their new requirement agreements. Failure to recertify will lead to termination. We're currently undergoing our biannual recertification now in 2025. So thank you very much for everybody that is going through their recertification. We appreciate you. Provider locations may voluntarily withdraw from the VFC program, of course. The VFC program may also terminate a VFC provider agreement and remove the provider location from the VFC program for failure to comply with program requirements. In either case, the provider of record must return spoiled or expired and viable vaccine or transfer all unused VFC supplied vaccines to another VFC provider. Enrolled provider locations are responsible for all VFC supplied vaccines in their practice until their provider agreement has been officially terminated. If the VFC facility wants to terminate their VFC participation, we ask that they complete this provider participation disenrollment form to the regional coordinator 30 days prior to disenrolling. This just helps us to gather some data so that we can record that for the CDC so that they can have this information. And then it also helps us to know locations where you're at and where we might find other VFC providers to transport out any excess vaccines. And then the educational, so any non-compliance, we will address with educational action plan, also known as an EAP. They are used to improve actions by providers that result in non-compliance. EAPs give providers the opportunity to review practices that are contradictory to requirements and make corrections by working with your regional coordinators or any other VFC program staff. EAPs usually take place through a conversation, advisement, education, or retraining. So here are some situations that might require an EAP. If at the end of the month, you upload your data loggers and there are unreported temperature excursions, mainly failure to maintain an alarm or your failure to maintain your digital data loggers properly. So failure to have them recalibrated or maintain in calibration devices. The provider did not promptly communicate key staff changes to the program. So the provider, the primary and the backup both walked out, and the provider of record didn't let the VFC program know, and there hasn't been any reconciliations done in months. This would definitely be a situation where we would want to address that with an EAP. Failure to provide required documents by the due date. Avoidable vaccine waste. So avoidable vaccine waste would be, say, during an outreach, you pulled up all of, you reconstituted all 50 doses of your MMR before the clinic even started. And then once the clinic started, you only had 10 patients show up. That would be avoidable vaccine waste. Misuse of vaccine. So administering VFC vaccines to an adult. Inventory mismanagement, inability to account for federally funded vaccines, and recurring reconciliation issues. Okay. And of course, fraud and abuse, we always want to avoid. So failing to comply with any part of the provider agreement would definitely be an example of fraud. Providing VFC vaccine to non-eligible patients, selling or misdirecting VFC vaccines in any way, billing for a patient or third party for VFC vaccines, charging more than the established maximum regional fee for the administration of a VFC vaccine, over-ordering or hoarding VFC vaccine, wasting vaccine, denying VFC eligible children vaccine because of a parent's inability to pay the administration fee, not documenting eligibility at every visit, failing to maintain records for 3 years, failing to reconcile appropriately, and failing to proper store and handle VFC vaccines are all examples of fraud and abuse. Okay, documentation record retention requirements. Maintain all paper-based and electronic records related to the VFC program for a minimum of 3 years. New Mexico law requires that doctors retain immunization records of minor patients for 10 years past the date of their last treatment or until that minor turns 21. It also typically requires the hospitals retain immunization records of minor patients until 10 years following the last discharge of that patient. It also requires that healthcare facilities retain billing records for a period of at least 6 years from the payment date. Okay, temporary office closures. If your provider's office or location has a planned temporary closure of 4 or more consecutive days, so a school break, there's a natural disaster, office remodel, etc. Providers must complete and submit a request for temporary vaccine transfer and storage or office closure form to the regional coordinator 2 weeks prior to the date of office closure. This request form must be received and approved by the VFC program prior to transporting your VFC vaccines to a holding location. Regional coordinators will review the request form and submit it to the VFC health educator, who will approve or deny the request. After receiving approval, providers must then complete one of the following forms based on how many days the office will be closed. So for 4 to 13 consecutive days, they'll fill out temporary vaccine transfer and storage monitoring plan. For 14 consecutive days or more, complete the office closure monitoring plan. Okay, and so VFC program, adult program, immunization program personnel will show up at your clinic in 3 different scenarios. The first are compliance visit, and these are required biannually, and you'll get a visit by your regional coordinator or contractors sometimes, reviewing the program's recommendations and requirements and providing formal education and training. There's also unannounced storage and handling visits, and we are required to visit 5% of VFC sites in each region, and we try to keep these to sites that really need an unannounced visit. So places that are having a lot of storage and handling issues or any kind of compliance issues are the ones that we would like to do those kind of surprise visits at. And then the last kind of visit are educational and programmatic support. These are usually, if they're mutually requested kind of visits for temperature log uploads, inventory recons. If there's a new employee that needs some training or any other kind of requested support from the sites. And then the last thing I want to go over was program integrity. Clinic staff must conduct themselves in an ethical, professional, and respectful manner in all interactions with the VFC program staff. Never destroy, alter, or falsify immunization or VFC program-related records. Make all vaccine administration records, privately and publicly funded, available to representatives from the New Mexico Department of Health Immunization Branch and the VFC program upon request. Comply with all mandatory corrective actions and the timeline provided by the VFC program. Unresolved mandatory corrective actions may result in prevention of completion of recertification processes and or placement on a conditional enrollment. Failure to complete required recertification may lead to program termination. And then last, acknowledgement that failure to meet conditional enrollment conditions may lead to permanent termination from the VFC program. And that's the last thing we want. We want good providers that do a great job. So that is the entire presentation. We really appreciate all you do. Thank you. You make all the difference.